Updating tonight's top stories, the inexorable spread of the Omicron variant cases in Australia suggesting contagion within the community. And in the Asia Pacific, the WHO calls on authorities to beef up vaccinations with infections driven by Omicron set to surge. Associate Professor Karen Grepin from the School of Public Health at the University of Hong Kong joins us live. Professor, new infections reported today in Malaysia and Australia, they're both suggesting that community transmission of Omicron is already happening. Now, if we assume that that should be the case, should we be changing our current control, management and containment strategies?
Yeah, there's a lot of evidence that this virus has now been in circulation for at least 3 weeks. And that means that it probably has spread to a number of countries around the world. And countries that have started to relax their border control measures over the last couple of months are likely receiving these cases, and there have been opportunities for community transmission to happen. So if countries are keen to try to get this variant of the virus under control, it might be a time to be rethinking what kinds of domestic strategies, for example, scaling up public health measures and vaccination, and how to get that done quickly.
So discovering just how far this new variant has spread, Professor Grepin, has involved retesting some old swabs, positive swabs from the past. Malaysia's done it, and they uncovered an Omicron case there. What are the benefits for countries to do this, to start retesting swabs, as it were?
Yeah, I mean, I think there's a lot of information that comes from this in the sense that we as a global community are still learning about where this virus came from and when it started to spread. So if countries are able to provide more information in terms of when cases started showing up within their borders, it helps that picture. But I think also if countries are quite concerned about this and want to think about starting contact tracing with cases that may have or may be suspected of having this variant, then it also provides an opportunity to go after those cases directly.
Of course, a big issue now is PCR testing for Omicron. Most tests right now, barring one, cannot distinguish between the Omicron and the Delta variants. The one that we do know of that can does that by identifying a mismatch in one part of SARS-CoV-2. So for new tests being developed right now, will they be building upon this principle, or are they using another way to identify one variant as opposed to another variant?
Yeah, these tests tend to be very, very specific. We kind of want them to be. And so, unfortunately, if the virus is mutated enough and in the right places, it is possible that the tests won't pick it up. I'm not an expert on PCR testing, but from my understanding, it is possible to relatively quickly, even with existing tests, have a hypothesis or a guess of which cases might actually be positive for this new variant, in which case we might as well at this point assume. But I think very quickly we'll be able to have new tests that will be sensitive enough for us to pick up this new variant quite quickly. And that will give us some advantage in terms of time in order to, for example, initiate public health measures to try to control the virus spread.
Professor Grepin, the arrival of this Omicron variant on our sort of doorstep, as it were, has come at a time when we've been relaxing restrictions. Now we know South Korea has had to reimpose its restrictions, delaying a move to live with COVID-19. That's something that we've all wanted to do as an end game to this pandemic. Cases are surging there in South Korea. Is reimposing restrictions, these movement restrictions and so on, to mitigate viral spread now an important step to move forward? Is that going to be the case?
Yeah, I think it does come down to a question of whether or not this virus is already there. I think border control measures are really only effective at reducing the number of cases as they come into a country. But once it's there, it is entirely a function of domestic public health measures, how far and how quickly this spreads. South Korea is a perfect example of a country that has made this decision to begin transitioning towards living with the virus. They have thousands of cases a day. This, if it does turn out to be much more transmissible, will contribute to that, but it won't be all of it, right? It seems strange to go after the new variant, but to ignore the old one. So I think what it points to is a consistent strategy of what does it really look like to transition to endemicity with this virus or living with it, and what kinds of public health measures are required in order to make that transition something that countries can go through.
Professor Grepin, you mentioned that we are still learning about this virus. I remember last week when this was making the headlines, the first identification of this variant. The questions were at that point were transmissibility, virulence, and the impact on diagnostic therapeutics, and as well as different vaccines. We were just talking about testing. At this point, if you could bring us up to date right now, what do we know about the Omicron variant in terms of transmissibility, its virulence, and its impact on diagnostics, therapeutics, and vaccines? What we do know right now.
Yeah, I mean, it's only been a week. I think that's what we have to keep reminding ourselves, that we've really set in this new variant exists. There is some preliminary data that does suggest that it seems to be more easy to transmit, and that could be the case, and that could be just a function of we're looking for it, and therefore we see it at this time. But there is some, evidence that does seem to suggest that it may be. But beyond that, I think it is still pretty early. I think we would be speculating to say too much about what we know in terms of how much it's going to affect vaccines, how much it's going to affect therapeutics. But I think there's enough reason to be concerned enough to give pause and maybe think a little bit about how countries want to adapt their strategies as a result of the introduction of this new variant.
Thanks for that, Professor Grepin. That was Associate Professor Karen Grepin from the School of Public Health at the University of Hong Kong.